Hello, and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at ThoroughPass. We would like to remind you that the Q&A feature is available, so feel free to send in your questions and comments throughout today's webinar. We would love to hear from you. And with that, I will turn it over to our speakers.
Hi, everyone. Welcome to our webinar today. My name is Christina Bartolesi. I am the head of sales engineering and compliance solutions at ThoroughPass. And today we're joined by Randy and Ryan, who are going to be talking to us about the simplifying multi-framework compliance in healthcare specifically. I'll give them an opportunity to introduce themselves in a moment, but like we mentioned, today's session is meant to be super interactive. So please feel free to add questions in the channel, in the chat. I'll be moderating that and using that to interweave directly the conversation, your questions, and make sure that you get responses from the experts that we have in the room. This is a very unique opportunity. And then you'll hear a little bit more about us and what we represent from each of our own sides. So the purpose of today's webinar is to really talk about multi-framework compliance in healthcare. Healthcare organizations are navigating increasing demands for data security and compliance across a multitude of frameworks, including SOC 2, HIPAA, and HITRUST, which leads to an endless cycle of needing to be constantly in audit or constantly thinking about compliance. But the good news is that there's a lot of overlapping requirements that can help the organizations break that repetition through a more streamlined approach in order to maximize efficiency. So we'll learn a little bit more about that today. And I'm very excited to welcome Randy and Ryan. Randy, if you want to go ahead and introduce yourself.
Hi, I'm Randy Siegel. I'm a partner in Manat Phelps and Phillips out of the New York office. I've been advising on HIPAA and healthcare related privacy matters for close to 19 years. And I work with a lot of emerging companies, helping them think through HIPAA compliance, either as a covered entity or as a business associate, and setting them up for success to partner with larger, more established healthcare stakeholders like healthcare systems and payers.
And
Hey
Ryan.
everybody, Ryan Patrick, Vice President of Adoption at HITRUST. My background is in cybersecurity in general. I've been doing that for a couple decades. Wow, time flies. But I've been focused on healthcare cybersecurity for probably about the last 15 years or so. So I've been with HITRUST 3 years, but prior to that, worked for a bunch of different professional service firms, as well as some insurance providers and healthcare providers themselves. So thanks for having me, Christina.
Yeah, I love it. I sit somewhere, I mean, definitely not going to call myself a lawyer because that's just simply not accurate, but I sit somewhere between Randy and Ryan's expertise. I actually come from a auditing background in the IT and healthcare space, where I actually became a HITRUST certified assessor. So I do spend a lot of time in the HITRUST space, but I spent the earliest days of my career performing a lot of SOC 2 and HIPAA assessments as well. So you've got a really great breadth of knowledge in the three of us here today. So please do feel free to light up the chat room. So we'll go ahead and get started. So one of the biggest things that we'll talk about today, and you'll see this theme kind of threaded throughout this, is really kind of this audit gap. This is one of the challenges that a lot of organizations are facing. And, the biggest thing that we're kind of seeing is understanding that there are common challenges in compliance and IT audits that are recurring. So Randy, I would love to hear your thoughts on what you see as being some of those common challenges in compliance and IT audits, and where you kind of feel is the best place to begin when that's what they're up against.
Sure. So, I mean, most individuals who are in the healthcare space realize that they have to comply with HIPAA. But I think sort of the understanding of what that means, both from just checking the box complying with HIPAA, as well as what the expectations is by both the government and potentially other partners, there may be a disconnect. I think for a long time, HIPAA compliance meant having robust policies and procedures and somebody designated as your privacy officer and security officer. And less attention was maybe given to ensuring that those policies and procedures were actually being implemented. And I think what we are seeing is that some of that is playing out in some of the breaches that we've seen and some of the the government attention to real compliance around protected health information. And so, you know, some of the things or the ways that I'm sort of framing the issue for clients now is that it's it's an upfront investment that pays dividends on the back end by hopefully helping to mitigate a breach from occurring at all. And, you know, if you do have a strong HIPAA compliance program and nonetheless suffer a breach, that it's going to mitigate your damages to have a strong compliance program in place and one that's been vetted potentially by a third party that demonstrates that you actually took compliance with the security rule in particular seriously. And also just thinking about it from a reputational perspective and marketing perspective, that a breach, even if the dollar amount isn't significant, if it makes its way into the press and you're, let's say, a provider of services, it could materially damage your ability to recruit patients or to partner. And so not just thinking about it as a monetary risk, but also as sort of like a real potential threat to your viability of your business, especially if you're new to healthcare.
Yeah, absolutely. And I think all of those points are so valid. And it's one of the things, you know, we'll talk a little bit more about this too, as we kind of talk about HITRUST as well. But it's this foundational element of needing to make sure that you have security and privacy best principles and practices in place. Making sure that you have that really strong foundation. So whether you're just starting out with a company or trying to get off of the ground, or you're a company that's been in operation for 20 plus years, you're still staring down the same requirements, the same type of things that need to be put into place. And in some regard, that's comforting, right? That the playing field is a lot more leveled. But in some places, it can also seem, once you start to take on additional requirements or different frameworks and things like that, it can definitely feel a little bit more daunting. So, and I'm curious, in your experience, Randy, is just like a follow-up, like, how do you typically see companies, at least traditionally, taking on the process of making sure that they have all of those policies and kind of that groundwork laid?
Sure. So, I mean, I think initially, and putting, you know, at all company sizes, it starts in-house. And usually somebody in-house, either the legal department, the privacy officer, the security officer, is sort of tasked with compiling a checklist to see if you meet the bare minimum requirements around policies and procedures. What often happens in that process is just through discovery, you know, a robust internal process is not just checking the box, but also potentially interviewing key stakeholders, even as part of your internal assessment, to say, hey, it says that we have this process to offboard employees, but like, let's pull some employee files and see how quickly their access was terminated. And what quickly comes out oftentimes in those internal reviews is that there are gaps in terms of actually implementing policies, and often gaps in like pretty low hanging fruit in terms of like what the expectations are. Often that prompts either a lawyer who's involved or you know, the governing body or whoever that person is reporting up to say, hey, you know what? Maybe we actually need a third party to come in and either confirm that we've cleaned up what we've said we've cleaned up, or tested these areas that we can't really test internally, either because we don't have the capabilities or because we don't have the bandwidth to do that. And
Yeah.
that often leads to us finding somebody to do a third-party review for both internal peace of mind, but also so that it's something that you can produce in the event anyone was looking to say, look, we took this super seriously. We dedicated resources and we brought in third parties with expertise to review, validate, and help us remediate any gaps that we identified.
Yes, exactly. And I think that that's, for the greater audience, of course, HIPAA is a self-attestation framework, right? There's no certification, no audit per se. There's no real way to kind of actually validate that, which is where a framework like HITRUST, for example, in a certification really assessment comes into play here, right? Making sure that there is that third-party validation, there is that assessment, and the way that HITRUST is really ultimately set up as well is to make sure that you have all of the check boxes checked, of course, like the framework requirements and the controls are all there, but taking, the approach of actually making sure everything's in place before you actually go through the assessment and HITRUST, issues it. Ryan, I would love to hear a little bit more about, from your point of view and the HITRUST point of view, like why the HITRUST centered approach can ultimately simplify the process. How are we helping people uncover some of these things before they become a problem, like Randy is mentioning?
Yeah, I think I want to just add some commentary to some of Randy's comments. HIPAA is important in the US healthcare industry, right? It's federal law. You are required to comply with it. You're required to do all of the things, all the safeguards, so on and so forth. But I think, Randy, you alluded to this. HIPAA's not the end all be all. It is not going to protect you because it's a compliance activity that's nearly 30 years old. And when I look at what's happening in the healthcare industry here in the United States, is we're too dependent on HIPAA. And I'm not suggesting we forget about HIPAA. That's not what I'm suggesting whatsoever. But we have to have this marriage between compliance activities and hard-nosed security activities to actually, one, comply, but two, to reduce risk. And I think that's where HITRUST fits in, is HITRUST builds the framework and the controls within the assessments that can result in certification with threat intelligence at the foundation. So it is not just us showing how you can comply with HIPAA or anything else.
Yeah.
We're actually following the threat data and building our controls to protect against the things that are happening in the threat landscape today. So foundationally, you've put security at the core. Now,
Right.
the other aspect of HITRUST that's interesting and somewhat unique is we've taken our framework and our controls and we've mapped it to over 60 other what we call authoritative sources. So think about other standards, regulations, and or frameworks: HIPAA, ISO, NIST, the AICPA's trust service criteria, GDPR, CCPA. I could go on and on probably for this full hour covering all those things. But the idea is you don't need to do a unique, disparate assessment to satisfy your reporting requirements. And a lot of healthcare organizations are in this multi-regulatory or multi-reporting environment where it's not just HIPAA. It's not just NIST. It's not just ISO, but it probably a combination of many different things. And historically, you'd have to do an individual assessment for each one of them, which is super painful. It is not fun. Whereas if you use HITRUST, because we've done all the mapping for you and because of our assurance methodology, the output of a HITRUST assessment can be used to report out against all these other things, whatever is relevant to you all. So to me, that's the biggest, I don't want to say differentiator, but the most compelling argument of why HITRUST should be put at the foundation is we've married compliance and security, and we've given you the tools to report.
Right. And it's so buildable too, right? And it takes into consideration so many factors as well, and provides so much more coverage than just the AICPA, ISO, HIPAA, like also like, let's just be frank, like you don't need to fall into one industry or bracket or place, for example, to benefit from HITRUST or to want to pursue HITRUST because it is so framework agnostic. You could be a healthcare company that works healthcare payments, for example, and you pursue HITRUST to sell into a bank, for example. It gives you the credibility for, you don't need to be so siloed, which I think is a really great way to think about it. And it's one of the reasons when I'm talking to customers or prospects who are starting from ground zero, you know, HITRUST is a really great place to start. You're covering so many bases in one fell swoop. And especially if you know you're going to be pursuing multiple authoritative sources, as HITRUST calls it, that's a really great place to start. But I am also curious, Ryan, when you do have somebody who comes to us, for example, and is like, okay, well, I'm maintaining 7 different certifications or frameworks, I'm following all these different requirements and laws, whatever it may be. What's your approach and conversation with them about adopting HITRUST, and, you know, how do you make it less painful to pursue HITRUST in lieu, for example, of maintaining all of those?
Yeah, the conversation traditionally boils down to, what is your audit fatigue like?
Yeah.
Are you constantly in the audit loop?
Audit
And
loop.
do you want to break out of that, right? Because let's say you're going, and I'm just going to pull stuff out of the air. Let's say you are an ISO shop, right? Well, ISO is a very high level set of controls around policy and procedure implementation to
Yep.
ensure that the controls are being governed and managed effectively. It's almost like a trickle down effect.
Mhm.
Whereas that may or may not be the case. And SOC 2 is somewhat variable in the control set. One SOC 2 is not like the next, generally speaking. So having a common language that is mapped to those other things that are important to you from a business perspective, but the fact that HITRUST is much more granular in its control element like levels, is a way of doing security at the baseline and letting the things higher up be satisfied. You think of Maslow's hierarchy of needs, right? Food and shelter are number one, right? Well, security kind of needs to be number one, whereas right now the industry is so focused on compliance, which may not protect them. You
Right.
put security at the foundation, you put HITRUST at the foundation because we've done all this work for you. And
Right.
I'm not sure if you want to get into like the shared responsibilities model and things of that nature, where you can leverage the work of others to satisfy these needs, which will then alleviate work on your behalf. Like there's just a lot of compelling factors for the use of HITRUST that will not only help you comply, but will also protect you and reduce the risk for your organization.
Yeah. And I think I'm gonna go a little off script here, Ryan, but love to just engage. And Brandy, I'm sure you'll also have a good feedback into this as well. But in thinking about what you just said, you know, compliance, security, where do you see privacy fitting into that whole model, as well as we kind of think about all of this holistically in customers or prospects, companies that are evaluating compliance as a whole? You know, one of the things that I see in my day-to-day role is people, like you're saying, Ryan, talking about compliance. A lot of times they're talking about security specifically. A lot of times they're talking about privacy specifically, but they're using this kind of like umbrella term of compliance. And, you know, I think, how do you help somebody ultimately identify what it is they're ultimately seeking, right? You know, if you're talking about like GDPR is a privacy standard at its core, for example, or HIPAA, like Randy mentioned, you know, there's the HIPAA security rule if you're a business associate, but you may also, if you're a covered entity, you're also responsible for the privacy side of it. So where does all of it kind of fit together, and how do you make the holistic picture come together?
Yeah, I think privacy is the the analogy is unsung hero. That's not a really good analogy, but it's something that is often kind of pushed to the side. Security has taken the forefront. If you look at breaches, it's because of a flaw in some kind of security program or, a flaw in a control. But privacy, especially here in the United States, and, I don't know how far down this rabbit hole you want to get. We care about privacy, but not like other countries. Other countries really, really care about privacy, and we operate somewhat willy-nilly with our personal and sensitive information. But there's definitely a relationship between privacy and security. In my personal opinion, you can't really have a sound privacy program without some foundational security built below it. But from a HITRUST perspective, we have privacy built into every single assessment. So whether you like it or not, you're going to get
You're going
to get asked privacy questions. Now that can expand and contract based on your choice on how much you want to dig into it.
Yeah.
But I think it's critical. And if you look at, what the EU is doing with the likes of Meta and Google and Microsoft around privacy and the violations of what's happening, we probably should be paying attention and giving a little more credence to privacy here in the US.
Yeah, we're a little behind.
Yeah,
Randy,
I mean,
here.
I think that, I do think that most healthcare stakeholders do have a privacy mindset, and maybe historically more predominantly a privacy mindset than a security mindset, which is why maybe we find ourselves in this situation. I mean, for a long time, I would tell clients, like, do you know how people have big breaches? They don't lock a door and they lose a lot of paper. They leave paper documentation in their car. And then there was like this mammoth shift to like all the breaches being security driven. So I do think that we are mindful, but it's important that the balance doesn't get shifted so much that we're forgetting about like privacy hygiene 101. I also think the states, as you all know, are sort of trying to fill the gap that we as a country are not as advanced as other countries with our thinking about privacy. And in some states, often there's this tension because the state privacy laws are actually considerably more restrictive from a privacy perspective than HIPAA. And there's been a lot of carve outs of these state privacy laws such that if you comply with HIPAA, you don't need to comply with the state privacy laws. And so interesting now, there's like a tension that in some ways under HIPAA, your data is less protected than it would be if you were just having consumer health data entered into, the internet or an unregulated entity. And so, I think it's important that, healthcare stakeholders, even if they're not subject to some of these more restrictive state laws, like the California Consumer Protection Act, My Health, My Data, take into account some of those privacy concepts when thinking through what is the best type of privacy standards to impose or to audit themselves within their organization. Not all of them, because obviously they would be overly limiting from the ability to like share data to provide care and that sort of things. But I think that as many states are moving towards ensuring privacy is more protected. And it seems to be a bipartisan issue at the state level, like both red states and purple states and blue states.
Well, and I think that's one of, and I appreciate both of your thoughts. And, if anybody in the chat or any of the listeners also have any thoughts on some of these items, privacy, compliance, security, whatever it may be, feel free to drop them in. But I think one of the things that I personally find, and Randy, you nailed it, Ryan, you did as well, especially around like Europe and the United States, like a little bit the goalpost keeps moving for us internally about like what and how necessarily. And I think there's I talk to a lot of companies when they ultimately come to ThoroughPass and they're like, I actually don't know where to begin. Like, I'm in this industry and I work with customers who are in Europe, but then I also have customers in the United States, and like I have some PHI, but not a lot. So like a lot of people end up coming to us and have these conversations, and they're kind of like, where do I go from here? And I think that that's kind of where people go. I've seen in the industry, especially in the last like 5 years, people are pursuing, to Ryan, one of your earlier points, people are pursuing the AICPA guidelines, ISO 27001, GDPR, HIPAA, like they're doing everything. They're doing the most because they're trying to have all of the coverage that they think they need to have, when in a lot of ways, you know, it's great if you actually contractually need to comply to all of those. We totally welcome that. And, you know, there's totally ways that that can be managed, but I'm curious, Ryan, how you've seen HITRUST, for example, simplify the need for all of these various frameworks and kind of still meeting the requirements.
Yeah, I touched on it a little bit,
Yeah.
right? HITRUST is pretty granular in its controls. I mean,
Yep.
there's not just the control statement that says you need to be doing X, Y, or Z, but there's elements within those controls that you have to demonstrate are there, and there's maturity and scalability, right? So HITRUST doesn't want to know that MFA's in place. HITRUST wants to see that it's in place for
Yeah.
every in-scope system, and it's in place for privileged access, remote access, and standard
Right.
users if that's what the risk drives for. So it becomes much more granular.
Right.
And what that gives an organization that is working within this multi-reporting, multi-regulated environment is it's a lot easier to share less information to satisfy other reporting requirements than
Yeah.
to have a limited amount of information and then try to get granular as needed. So it's a lot easier, like I said, to use the work against HITRUST to satisfy more higher level requirements.
Right. And I think that that is one of the biggest things too, because at the end of the day, you may be providing one policy, for example, that actually is able to satisfy multiple different requirements across various, you know, I always use this with prospects. An information security policy or an employee handbook, for example, are two of the most common simple requirements that quite literally every single framework or standard under the sun is going to require for you. But why would you go and provide that or have that be evaluated 7 different times, for example? So there's ways to streamline that work, to streamline that audit, and we'll talk a little bit more about that as well. But I think that's a really great point, Ryan. We do have a question in the chat. What are some common pitfalls to look out for and avoid when aligning these frameworks? I think, Ryan, you just touched on this for sure very clearly as well, but I'll even just add my 2 cents, and Randy and Ryan, please feel free to, you know, add on top of it. But you know, I think one of the biggest things is making a set of framework or policies per framework. So framework specific policies and procedures. While that is necessary at times, depending on the framework, whatever it may be, you can't necessarily 100% avoid that. But having as much consolidated into one set also makes it not only more efficient for you, but it actually makes you more likely to stay compliant, to stay within the boundaries and the regulations, because you're keeping up with one set versus 5 that you have to keep track of. And I think that that's something that becomes particularly challenging for especially smaller organizations or people that wear a lot of different hats in the GRC or the compliance or security space. They don't have time to update 6 different set of policies just because version XYZ came out and you need to modify it. So that's kind of one area that, you know, on top of what Ryan was talking about, when it's like maximizing the efficiencies across like the controls in terms of granularity. But Randy, Ryan, anything to add there?
No, I think
I have a thought, but Randy, please go ahead.
No, I think you all covered it. I mean, I think I always recommend, and this is very low tech of me because I'm a lawyer who is not super tech enabled. But it's starting with a spreadsheet or a document that's sort of folding in the different requirements so that as you're drafting, revising policies, thinking through your protocols, you're doing it sort of with a holistic view of what you need to comply with. And I often also advise layering on top, best practices or industry expectations in terms of if you are someone who's going to go contract with a hospital system or a payer or participate in claims payments, there's certain expectations that they are going to impose on you, maybe related to disaster recovery or offboarding, onboarding, notification to them of onboarding or offboarding. And you may want to layer those in as well so that you are prepared to say, yes, we comply. And you're not having to go, as you mentioned, back through the exercise with your limited resources to like retrofit things to comply with a new law or a new expectation.
Yeah, and I want to piggyback off of the comments from both of you and then add something new. If you think about what Christina mentioned, sometimes it's unavoidable to have framework specific policies, but where you can avoid that, you should avoid it, right? Because if you think about the purpose of a policy and probably more importantly, a procedure, is there supposed to be a document that guides staff and employees and the organization and what it needs to be doing. If you have 6 different versions of your policies and procedures, it becomes not only cumbersome to keep them updated, but think about the average employee who couldn't spell HITRUST, couldn't spell ISO, couldn't spell NIST, couldn't spell whatever, now trying to decipher which policy matters to them in their world, right? So consolidating those as much as possible, I just want to hammer that home. I think that is a common pitfall. The second thing, which is going to sound somewhat counterintuitive to the discussion today, is don't assume that SOC 2, there's my hand, SOC 2 equals HITRUST carte blanche, right? Or HITRUST equals ISO or whatever. Pick the different flavors. There are differences. There's a ton of overlap in the controls that are covered in these different standards or regulations. But the way that they're written and the elements within those controls matter. So if your mindset is, I've achieved SOC 2 attestation, a clean report, I can automatically get HITRUST. It's probably not going to be that simple. You're going to be able to leverage a lot of that work, but it's not a one for one. And I've seen a lot of organizations come into the multi-reporting, multi-regulated environment thinking, well, I've done X, so that equals Y, I can get Z. And it's just not that. Just be open-minded is what I'm telling you. It's not impossible. You just have to understand that there may be additional work or there's additional things you may have to provide on top of what you've already done.
Exactly. And I think that is such a good point and something that I think, we talked about it at the very beginning of the webinar, bringing it back to that around making sure that you have that strong foundation that does include kind of that security. But actually, I'll answer kind of in my response here. One of the questions in the chat, going back to compliance fatigue, is there an ideal mix of compliance framework testing that healthcare companies should be testing on? HIPAA, HITRUST, PCI DSS, SOC 2. I think going off of what Ryan just mentioned, and even just from my own experience in providing this type of guidance to prospects on calls quite literally all day, every day, I'll always go back to asking you or your company, who are your clients, who are you servicing, and what are they asking of you? Because, and Ryan, I'd love your opinion, and Randy as well on this, but just to say you're in the healthcare industry doesn't necessarily mean that there's a one size fits all in terms of what compliance frameworks are going to be required of you, or that during the procurement process, you know Google is going to ask for XYZ, or you know United Healthcare is going to ask for ABC. There's unfortunately not a level of predictability that we're ever going to be able to standardize, but that's actually a good thing, because meeting these requirements allows you to have a level of customization that actually represents who you are as a business, and showcase, like Ryan and Randy mentioned, what you've spent time investing in and making sure that it matches the way that you run your organization, and that you can make a third party comfortable to do business with you. That's the ultimate purpose also of going through this. Of course, you want your company to be secure, and you want to make sure that you have all the best practices in place and you're not exposing yourself to risk. But you need to think about also what your customers are requiring of you, what type of data you have, the way that you interact with them, and find the perfect mix that makes sense to you. But Ryan, Randy, any additional feedback on that point?
So with my HITRUST hat on, I'm going to say HITRUST is all you need. Taking my HITRUST hat off, I want to reiterate what you just said, Christina. Like, your business drivers and what matters to your organization are going to be the deciding factors, right? If you're not processing payment card information, don't worry about PCI. There's no value add there. If your customers aren't asking for SOC 2, or they're not asking for HITRUST, then maybe it's not in the cards, right? I would say HITRUST should be in the cards, because I am passionate about this marriage between compliance and security. The only thing that I would say as a healthcare entity that you will not be able to avoid is HIPAA. You will always do HIPAA. So what you do beyond that, again, your business drivers, what matters to your constituents, whether that be internal stakeholders, external stakeholders, regulators, whoever that may be, those constituents will drive what you should be testing against. But what I will repeat is, don't be solely focused on compliance. Compliance will not, in most cases, stop a breach or an incident or what have you. So you need to make sure that you're putting security as something that is focused on while complying.
So yeah, just to address sort of generally some questions in the chat around, what if you're a smaller organization or a solo practitioner? There's lots of competing priorities for both time and resources. And so, this is, when I talk to clients, I think, sort of piggybacking on what Ryan and Christina are saying, it's important to understand your business model and what types of data you're collecting, how you're collecting it, what systems you're utilizing, and how you're sharing data to inform potentially how to prioritize the risks. Because in the end, you may not be able to financially afford to mitigate all the risks at one time, or to be 100% compliant, like, just, practically speaking. And I don't think there's necessarily, there's not a one size, fits all approach to how you mitigate that. And so I think it's important, even when using a framework, and, I trust, no pun intended, that HITRUST does this as part of their review, is that they're recognizing potentially that what a solo or small group practice may need to put in place, to and what risks might be appropriate for them to take is going to be different than a large multi-state health system where all their data is being, is interoperable, and then they're sharing it here and they're connected to an HIE there. It's going to look different, and it has to look different. I think there's low-hanging fruit that everyone, no matter your size or sophistication, should prioritize.
Right.
Your laptop should be encrypted. If you have PHI on your laptop, it should be encrypted, like basic standard. If you're emailing PHI that has any sensitivity in it, you should be using an encrypted platform. It is no longer like a super, it doesn't create as much friction as it did 15 years ago. And you should be constantly reevaluating whether you can mitigate risks based on the costs, because a lot of times the costs have come down maybe since the last time you looked into the issue. Um, and you know, taking a look at your organization in light of what's happening out there in the world with regard to cybersecurity. So I do want to sort of underscore that it's not like a one and done
Right.
process. And I think the other thing is sort of building it in. We haven't really talked about this as much, but like building it into your overall compliance program, governance program. You know, I think it's important if you, even in a smaller system, that you are reporting to the board of directors or your committee around security and privacy and the risks you're seeing there, because these are just as important risks to be taken up and
Right.
having decisions made by the governing body or managers as, you know, basic financial decisions. So I think those are things that I recommend that, you know, the IT department, for instance, is not the sole determiner of what to prioritize in terms of privacy and security.
Absolutely. All really, really good points. I do want to be mindful of time. We'll continue to answer the questions in the chat. If we don't get to all the questions, we will follow up with you individually with a response. So not to worry, you can continue to post questions in there. I'm going to switch gears, well, not really switch gears, kind of follow up on that thread as well. That Randy was just talking about, you know, in terms of, you know, getting the management buy-in, and then some of the questions that are in the chat, for example, talking about what multi-audit, multi-framework, where to prioritize your time. I'm going to have both my ThoroughPass and HITRUST hat on for this moment, just because they go very hand in hand as great partners that we are. And, you know, I do think that there is ultimately like a really great way to marry the two, because going through, you know, while we talked about a lot of different frameworks and complying with those, it was really necessary to kind of preface that while, you know, you may need to maintain all of these different frameworks and there may be endless compliance and audit fatigue, there's a simpler way to do it. And what really ThoroughPass and HITRUST have done together, you know, since 2022, so it's been a couple of years of this partnership at this time, which like Ryan mentioned, time flies, is really to be able to unify the controls and the audits. Being actual HITRUST external assessors, we combine the technology and the expertise with HITRUST's unique framework and positioning to be able to provide kind of what that experience and endless cycle would otherwise look like for customers. Awesome, and then we can go to the next slide. So the way that ThoroughPass really ultimately works is that it's a platform and an audit in one place, where you may have traditionally, I know Randy had mentioned this earlier in the conversation, but you know, for something like HIPAA or GDPR, where it's a regulation rather than an actual certifiable assessment or standard, ThoroughPass can provide both the expertise as well as the actual framework that you would be complying with. So HIPAA may be something that you want to self-manage. You want to go through all of those controls. You want to make sure that you have them in place, and you want to say, I think I'm good. I have everything in place that I need. Whereas when you have something like HITRUST that requires you to have the external validation to work directly, you know, in partnership with them, ThoroughPass has the ability to complete both sides of that, the readiness and the audit. And works very, very closely with HITRUST to be able to deliver that end-to-end experience. It also, you know, you could, as we mentioned earlier, be pursuing multiple frameworks. Let's say you're pursuing HITRUST, PCI DSS, and SOC 2. You can marry all of that into one audit, for example, or one framework, so that for when I talked about needing to have an information security policy for all three of those, you have one universal information security policy that meets all three of the standards, and you're completing that once and it's validated one time. So this is kind of what the end-to-end experience and seamless compliance looks like, combining people and technology. I think there was a question in the chat that was asking, do I invest in the people? Do I invest in the technology? And I will never really be able to choose one, especially when ThoroughPass at the end of the day has both, right? Why should you have to choose one or the other? When you get both, as well as the expertise. And then next slide. So working with ThoroughPass to achieve HITRUST. This is, we worked really closely with HITRUST and have a lot of HITRUST assessors, myself being one of them in-house, that actually worked on building out the program, which includes, policy and control onboarding, scoping, roadmap implementation, audit and assessment, growth and maintenance. So obviously you're going to be working closely with ThoroughPass on the policy and control onboarding, scoping, and roadmap implementation, which ultimately then makes you successful in the audit with HITRUST. So we've worked with them to make sure that, all of the controls are met, that your audit is going to be successful. There's no gaps, like Randy had mentioned earlier. You already have that foundation that you built. Maybe you started with HITRUST, maybe you started with something else and you added on top of it. You already have that groundwork there. And then adding in HITRUST gives you that exposure and the larger kind of bang for your buck type of an experience, that gives you the mobility to go in any direction, because obviously this is healthcare specific, but I work with a ton of customers that have HITRUST that are not in the healthcare space. And I'm sure Ryan would also say that. I mentioned the payment industry earlier, banks, insurance. There's so much more than just the healthcare space. So I do have one final question for Ryan, and I would love to hear kind of also, Randy, your experience with this as well. But how have you seen tools like ThoroughPass being implemented, actually being able to assist customers or companies, maybe that are small, but also that are quite large, enterprise-ready customers, managing a multitude of different frameworks, or maybe they're just maintaining HITRUST or HIPAA? How have you seen a tool be able to help alleviate some of the pain or that audit fatigue that we started the conversation with?
Yeah, so before I jump into that, I want to acknowledge something that came up in the questions. Someone mentioned my comment on Maslow's hierarchy of needs and putting patients and the relationship between patients and physicians at the forefront. And I 100% agree. As someone who spent about 4 days in the hospital 2 weeks ago, always provide quality patient care before you really worry about privacy and security. That is something that should never come before providing that quality patient care. But I think it's, Christina, to answer your question specifically, I think it's important for me to give a little context on how a HITRUST assessment goes. HITRUST is a trust but verify type of assessment. It is not a self-attestation. It's not, yep, I'm doing MFA and don't please check that I'm doing MFA. Like, you will prove that you're doing these things, right? And what I can tell you is you are going to generate a lot of evidence to support the fact that you believe these controls are in place and they're mature. And generating that evidence alone is pretty cumbersome, right? So tools like ThoroughPass, where they can automate a lot of that for you, especially if you've already done work against another framework and you can just pull that evidence over to, say, HITRUST, makes life a lot easier. And to give you some ballpark figures for HITRUST, most robust and comprehensive assessment, the R2, you will likely generate 500 to 800 artifacts of evidence. Anything where ThoroughPass may have direct integration with security tools where they can pull that out, or they've already collected it for something else, will make life a lot easier. So utilizing a tool like this not only will get you to not want to pull your hair out, but it will streamline the process and make it that much easier and, get through it a lot quicker.
Right. Yeah, and I think that's thank you for the color and context there too, because I think, talking about automation and things like that is very buzzy. And I think one of the things I've always really appreciated about HITRUST is it's a tech company, same like ThoroPass is, but there's people behind how this is actually going to happen. There needs to be validation, independent set of eyes, and actually making sure that X equals X the way that it actually is supposed to say, hey, we put our money where our mouth is. So, having a real person behind the technology that's actually evaluating that is actually going to meet the requirements, I think carries a lot of substance. Minimizes for sure surprises at the time of audit, because it's great to have a checklist, for example, but doing it, as somebody who used to watch companies either work with a tool or to just try to go through the process, by it and just work through it. It's challenging, right? You're guessing, you're not 100% sure that when the auditor or the assessor is going to be looking at it, that it's 100% going to meet the requirements. At what point that becomes a little bit of like a scramble to make sure that everything is in place. So, I think making sure that there's a human behind that, making sure that the monitors and the automation component is actually satisfying the requirement is pretty huge. But Randy, didn't know if you had any additional opinions on that as well, if there's anything, if you've seen tools used in the space to meet these requirements or standards, or if you see if you have any opinions about what the future of maintaining this and complying looks like for companies moving forward.
I don't have anything else to offer around tools. I mean, I've seen clients sort of Frankenstein their own tools together. Small practices use some of the OCR tools that are available. I think, those have some limitations. As probably most of last minute effort as a gift for the holidays, there was a proposed significant changes to the HIPAA security rule. And I think it remains to be seen what happens with those.
Right.
But if those ultimately get put into final rule, even if modified, it's going to impose significant requirements on covered entities and business associates with regard to their security standards. I'm sure that you guys are already thinking through how to incorporate those. And I think even if they are not adopted, it does signal, at least under the prior administrations, what OCR expects from compliance, even if not expressly articulated in the rule. Like in several instances, they kind of said, well, we thought this was obvious that you had to implement what was in your policies, but we're going to state that for you clearly here. And so I think the expectation, or it remains to be seen what happens under this administration, but I think even if they're not adopted, looking through that rule and seeing what some of the new imposed requirements were around vulnerability scans and data mapping and expectations around multi-factor authentication, et cetera, are good indicators of where the industry standard is going, even if the regulations do not follow right away.
Yeah. And I think that's a really good point too, because I think we've watched regulations kind of take a longer time to not only be adopted by individual companies, but also to take place in firm standing of what is going to be required, deadlines for remediation, whatever it may be. And I think you bring out a really good point, Randy, that is like, being ahead of the curve on that. You know, we don't know 100% what it's going to look like, but making sure that we know that it's an if, not a when type of a mentality when it comes to a lot of this is kind of always the approach I recommend for companies. It sounds like we've had a good bit of activity and involvement in registrants that are maybe in the smaller healthcare company, small healthcare size of things, and or maybe just beginning your journey to trying to understand and think through what compliance and security and privacy really means for the organization. And the best piece of advice that I can give you, that I think we would all give you, is to not wait to start, to really put into motion whatever you choose to do, to really put into motion getting pen to paper on some of this stuff and letting it be a more natural, holistic approach rather than a hair on fire situation. It's a lot more of a mindful exercise where you can actually think about getting management buy-in, understanding your business from a holistic point of view, whatever it may be. But it also just makes the experience significantly better. I mean, I'm slightly biased because I have spent my entire career in this space, but I don't think that I genuinely, wholeheartedly do not believe that compliance and security need to be painful exercises. I think it's about how you actually set yourself up for success and making sure that you have the right tools in place to be able to do that and the right expertise. So, you know, your friends at ThoroughPass, your friends at HITRUST, Randy, everybody is here to support you as you try to figure out what that journey looks like for you. So, with that being said, I know there's a few more questions in the chat. We will be following up after the webinar and getting in touch with you all. But Randy, Ryan, I just want to say thank you so much for your time. This was a really, really awesome conversation. And I hope everybody, you know, it's not easy right after lunch, at least in the New York space or wherever you may be, to take the time out of your day for an hour. Especially on a Wednesday, but we appreciate you coming. And Randy, Ryan, if you have anything else to say, but thank you all so much.
Thank you to ThoroughPass and to everyone that joined us today. Please visit our website at community.hlth.com to catch up on all Health Go Live webinars. And join us in Nashville February 16th through 19th for Vive 2025.